We put the documents out there. I'll give you my take on them, but you can look at them and have your own take. But the best thing is that you can look at them, and you wouldn't be able to look at them but for Judicial Watch. What I love about Judicial Watch is if there's a major issue, we almost always are second to none in trying to figure out the truth about it. And that obviously goes for the COVID scandal. And the COVID scandal is so broad and has been so damaging to America and to other places in the world, I think we can't do enough to investigate it. And one of the things we've done is investigated the creation and the management and the promotion of the COVID vaccines, which, as you know, are controversial. And one of the things we found is that they didn't want to tell us basic information about adverse events and issues they were finding when they were testing the vaccines. We got information about that out, and other things that I think Americans would have been very interested in knowing before they were forced in too many instances to take the vaccines. And on top of all of that, then even once it became clear the vaccines weren't doing what everyone was told they were going to be doing, they started pushing boosters. A third booster, a fourth booster, a fifth booster. Now I think is this the sixth booster they're going to be planning and pushing for this fall and winter? I don't know. And so you would think when we have this important medical development with these vaccines, even giving them the benefit of the doubt they don't deserve, there would be substantial studies behind them showing their safety and efficacy. And Judicial Watch has shown that's really not the case. And specifically, we have new records that show that there was only a 23-person study done of a COVID vaccine safety, in a COVID vaccine safety study, before it was approved by the Biden administration. We got 58 pages of records. These are what the records look like. So we get the documents to come in. Investigational new drug application, right? And you get, it's filled out, and letters are sent, and the studies are attached. And here's the study. I don't know if you can see it, but anyway, we'll pop it up. And they've got all the charts and everything. It's all based on 23 people. They gave the booster to 23 people. Well, they wanted to give it to 24, but one of the people said, I'm not taking a third shot, thank you. Now, I don't know about you. Does a study of 23 people and analyzing how they handled the vaccine booster over a month, is that enough to reassure you the booster was safe and effective and useful to take? I don't know. Maybe it is enough for you. But wouldn't you like to know that it was a 23-person study that was key behind the recommendation to provide the booster to, I think within a few months, 8.6 million people got it? I don't think so, but people have different views. This is what I love also about Judicial Watch. We put the documents out there. I'll give you my take on them, but you can look at them and have your own take. But the best thing is that you can look at them, and you wouldn't be able to look at them but for Judicial Watch. So we had sued for records submitted by Pfizer and BioNTech to the FDA, including BARDA, related to booster vaccinations for the SARS-CoV-2 virus. So this BARDA is the Biomedical Advanced Research and Development Authority, and it's been heavily involved in the development of the COVID-19 vaccine. The authority provides an integrated, systematic approach to the development of necessary vaccines, drugs, therapies, and diagnostic tools for public health, medical emergencies such as chemical, biological, radiological, neurological, and nuclear accidents, incidents, and attacks, pandemic, influenza, and emerging infectious diseases. And BioNTech is the German pharmaceutical company that partnered with Pfizer in developing their original vaccine. So the documents we obtained include a July study, I guess it was must have been July 2021. Yeah, a July 2021 study titled Phase 1 Booster Safety and Immunogenicity Data Up to 1 month Post-Dose 3 of the study, and they give us all the numbers related to the study. The submission includes, and this is a quote, it's a group of people that had received 2 vaccine shots and 7 to 9 months later, the 3rd booster shot. So they're testing the safety and efficacy of the 3rd booster. And as you can see there on the screen, the submission includes preliminary findings from a subset of younger, 18 to 55 years of age, and older, 65 to 85 years of age, participants in the Phase 1 part of study, you can see CXXXXXX, who completed the initial 2-dose series of the COVID vaccine, given approximately 3 weeks apart, and then received the 3rd dose booster of the vaccine approximately 7 to 9 months after the 2nd dose. Data were collected through the cutoff date of May 2021. So this study was done in the spring of 2021. The participants were evaluated for symptoms for up to 1 month after the booster shot. The booster's immunogenicity, or how well a vaccine works over time, was evaluated 7 days and 1 month after the booster. The participants included 11 people aged 15 to 55 and 12 people aged 65 to 85. Of the younger group, there were 9 females and 2 males, 8 of whom were white, 1 was black, and 2 were Asian. Of the older group, 6 were females, 6 were males, and all were white. The study reports that a booster dose increases the breadth of the neutralizing response against SARS-CoV variants, and that the data suggests that a 3rd dose could prolong protection and further increase the breadth of protection. And the Pfizer study was sent to Marian Gruber, Director of the Office of Vaccines Research and Review. So one of the big issues, and these were people who supported the initial vaccines, especially within the FDA, they thought, you know, these initial vaccines, we don't have real information that they're not effective against the variants. So why are we fighting? Or why are we pushing for another booster? I mean, is it even needed? And sure enough, shortly after this was submitted, these studies, I guess there were 2 studies submitted, the White House in August said it was moving aggressively to roll out the booster shots. And despite yet not having even received clearance from the FDA. And then we found out that Gruber, who had received these documents, as Dr. Gruber and his deputy, because this is where he was the one who received the studies, were leaving the agency because they were frustrated with the CDC and Biden White House interference on vaccine decisions. They were among a group of resigning doctors who agreed that available evidence doesn't yet indicate a need for COVID-19 vaccine booster shots among the general population. The FDA said it based its decision on the documents presented by Pfizer, as well as input from the CDC, the Israeli Ministry of Health, and the University of Bristol in UK. And as I said, 3 weeks after the approval, it wasn't 8.3, it was 8.9 million boosters had been administered. With the planned push for new boosters by the Biden administration, the public would do well to examine these troubling documents about the shotgun approval of private COVID boosters. Now, Judicial Watch has a number of Freedom of Information Act lawsuits and ongoing FOIA investigations on this issue. And we've talked about how they've hidden adverse events that we have uncovered. For instance, rats were having fetal rats were having wavy ribs, which could be an issue. How the lipid nanoparticles were residing in organs that they told us it really wouldn't be an issue with. All sorts of corruption there. Corruption in how lies, and we exposed how the Biden administration, how the Fauci agency was funding coronavirus mutant research in China, et cetera, et cetera. But here we now have, as we said earlier, the Biden administration pushing another booster, and you can bet the basis for this other booster is as weak as we're seeing with the prior booster that led senior health officials to resign over once Biden started to push it. And again, it's Judicial Watch doing the heavy lifting on this important public health issue and exposing that the government, when recommending and spending money on COVID vaccines, really didn't do their due diligence by any measure. And where would we be without Judicial Watch on this? We'd be in the dark, and dare I say it, some people would be a lot worse off health-wise without our warning folks about what the CDC and FDA have been hiding from us about these COVID vaccines. Thanks for watching. Don't forget to hit that subscribe button and like our video down below.